You know what really grinds my gears, what really gets my blood boiling, what really makes me question humanity is when you, as a provider, you meaning a doctor, an OB, somebody that specializes in hormones, women's health, whatever it is that you do, and you're not assessing for trauma history, what are you doing? Because trauma happens to the body, it happens to the mind. So if you have a patient or a client that is coming in with unexplained aches and pains, nausea, diarrhea, acid reflux, chronic migraines, insomnia, weight gain, weight loss, things in which their body is shutting down, freezing, hyperactive muscles, what are you doing? Are you just throwing a prescription at this and saying, here you go, see you in 3 months? Or are you saying, hey, what happened? Tell me a little bit. Let me make some space for you. Let me check in. Let me do a trauma screening. Let me ask some questions that are open ended. And let me ask it in a way that allows you to feel safe and okay without opening up a huge trauma wound, right? Or a trauma scar. Why are we doing this to our people? I'm a therapist, I'm trauma informed. So anytime I refer somebody to a provider, it's going to be trauma informed. But I have a lot of clients out there that are navigating the healthcare system alone. They're not being taken seriously. So they're showing up and their body is shutting down. And as we get to the process of digging deeper in trauma history, things are going to happen in their body where their body's going to hurt more. Things are going to be released somatically. When we do brain spotting, things are going to come to the surface. They might find relief instantly, but it could also bring up stuff in which their body is still working through because trauma is also what happens to you. Trauma can be fragmented within your body and your brain. They're trying to scan and connect the mind and body. So if you're a provider and you're not assessing for trauma, what are you doing? I have met countless providers that I've networked with, and I asked them this question: what are you doing as a trauma assessment tool? How are you assessing for trauma? And they look at me and they go, huh? And I say, well, PCOS and Hashimoto's and rheumatoid arthritis and a lot of other ailments that are autoimmune diseases are often linked to a lot of trauma. And they look at me like I don't know what I'm talking about. So, my question is, if you have had a trauma history, do you feel seen and supported by your doctor? Do you feel seen and supported by the other specialists that you go to? And if not, say something. I always say, if you don't like it, try somewhere else. And I realize that that can be really hard. It's a hard process. But I want to encourage you that you are not alone. If you have a therapist that's trauma informed, they can help you unpack this, they can help you process it, they can help you write a letter with your diagnoses and just a summary to help them stay informed. But it's not your responsibility, it's theirs. So, providers that are not trauma informed, get out there and go to that CEU. Go out there and educate yourself. My name is Shanazi Kane. I am a licensed professional therapist, speaker, consultant. I'm here to cheer you on, but also let's get real. A lot of people are going through trauma. You must be trauma informed.